Hello, everyone, and good morning. Welcome. If you're joining us from this area of the region, good morning. If not, good afternoon, depending on where you are located. Next slide, please. Again, we want to welcome you to today's webinar, Encouraging Healthy Aging with Serious Mental Health Conditions. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC. We're housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy Rivera, and I'm the project coordinator of the center, and I'll be introducing our webinar speaker for today. Next slide, please. The MHTTC is funded by SAMHSA, the Substance Use and Mental Health Services Administration, to enhance the capacity of the behavioral health workforce to deliver evidence-based and promising practices to individuals with mental health conditions. We also provide training programs on evidence-based practices for serious mental health conditions, wellness and recovery for providers and people with mental health conditions, school mental health, Hispanic and Latinx mental health education, and online education courses such as Wellness Matters, IMR, Functional Thinking, and more. Next slide, please. As a reminder, all of the training programs, products, and services that you see on the diagram on your screen are available to you at no cost. Next slide, please. And if you're interested in staying up to date with the events and products that the Northeastern Caribbean MHTTC is providing, we ask that you please sign up to receive our email communications. You can sign up by hovering over the QR code that you see on your screen, and it'll take you directly to our email listserv registration page. Now, following the webinar, you'll be asked to complete a brief survey. We value your feedback and use it to improve our activities and inform future events. These surveys are also important because our continued funding is linked to them. So we thank you in advance for your participation. We also want to let you know that this webinar is being recorded and posted on our website within 7 days of this webinar broadcast. And you'll also be emailed a link to download your certificate of completion. Next slide, please. At the time of this presentation, Marian Delphin Rittman served as acting assistant secretary for the mental health and substance use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS, SAMHSA, for the opinions described in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenter today by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go, and I'll ask them of the presenter during the Q&A time towards the end of the presentation. During this webinar, our presenter may pose questions to you by using the poll feature. Please feel free to use that poll to provide your input. Next slide, please. The MHTTC network is committed to affirming respectful and recovery-oriented language in all activities. Next slide, please. And as a reminder, SAMHSA has launched a 988 Suicide and Crisis Lifeline for people who are experiencing suicidal ideation, mental health substance use crisis, are experiencing emotional distress, or if they are concerned about someone in crisis. Next. Now let's begin our webinar. We have with us Dr. Michelle Zechner. Dr. Michelle Zechner, who uses pronouns she, her, is an associate professor at Rutgers University in the Department of Psychiatric Rehabilitation and Counseling Professions, where she teaches, conducts research on aging and wellness, and focuses on interprofessional collaboration to improve healthcare for people living with serious mental health conditions. She developed one of the first undergraduate courses on aging and psychiatric rehabilitation. Dr. Zechner is active in mental health workforce development, including presenting at national and international conferences, and has written extensively on aging for people living with mental health conditions. She has worked in academia, mental health administration, nursing homes, community aging services, and in outpatient and inpatient mental health settings. I want to welcome everyone again, and I will turn it over now to our presenter.
I was muted. Good morning, everyone. Thank you so much, Kati, for the introduction. And I'm so excited to see all of you here about this topic that I feel really passionate about, healthy aging for people living with mental health conditions. And it's exciting to see people from all over the United States. Welcome. So I'm hoping that we'll talk about healthy aging today. Think about some methods to promote healthy aging and some strategies, but I also want to hear a little bit from you. And I see all of you are so wonderful, waving hello from all different parts of the country. And if you feel like it, you could drop in your role if you like. If not, that's fine too. If you haven't put your name in the chat, that's, take an opportunity to do that. It's nice for me to see what's going on. And I am paying attention to the chat. I will say though that sometimes I get distracted and I'm not able to respond, but Kati is going to be sort of helping me redirect. So if you have a question that feels very urgent or timely, please feel free to drop it in the chat and Kati will help me monitor that. Kati, can we start with the polls, please?
Absolutely. So at this time, I will be launching the first poll.
Thank you. So the first poll is just going to ask you, do you currently work with people aging with mental health conditions? Yes or no. So if you can, just sort of pop in there, yes or no. Oh, exciting. We've got people really doing some interesting stuff. Housing, waiver program services, case manager, federal prison. Wow. And mission ministries. Very nice. Okay. So let's end the poll now, Kati, please, and post the results. Okay, so a lot of folks are already working with people aging with mental health conditions. Very cool. It's such a new area, and although for those of us who've been in the field a while, we probably have experienced it somewhere along the road. But I know, at least for me, I got interested in this area, and there wasn't a lot out there, so I keep trying to learn more and learn more. And it seems like we've got a room full of knowledgeable folks. So thank you for sharing that. Um, and then poll two, please, Kati. Patient advocate. Oh, wow. And chaplain. Oh, really cool. So I clearly I picked these categories. I'm probably off by a mile because I see a lot of folks doing some really interesting stuff, including, veteran work, people working in HIV, people doing training, intake support specialist. Wonderful. So a lot of different director of training. Welcome, everyone. It's lovely to see you all here. Let's close the poll now, please, Kati. All right. So we have a lot of other, really wonderful to have all of you here. Okay, so let's close that out. So the first activity that I'd like you to think about is to think about yourself for a moment. Put your binoculars on, look off into the horizon, and imagine and think about what your hopes are for your well-being and health in 20 years. What do you hope for yourself? And when I think about that, I think that's a question that we might want to be asking the people that we support. It should be a question that we ask ourselves and continue to reflect upon in terms of healthy aging, because that will sort of shape how we connect to people, how we talk to people. And it may be things like I'd like to be able to walk. I'd like to be able to live as independently as possible. I'd like to have people around me who love me. I'd like to have friends. For me personally, I need to have a pet or two. So you can sort of think about that and ask the people that you support, what do you hope for in terms of your well-being and health? And someone wrote in health, basically, physical health for sure. And everything is functioning well. Yeah, and we'll be talking about functioning as well. So healthy aging is really, and I really like this organization, the Pan American Health Organization, which is a division of the World Health Organization. They put together a whole campaign about healthy aging, and it's in Spanish and English, but their definition I particularly like. Sometimes healthy aging is called positive aging, but I'm going to stick with the language healthy today. Healthy aging is a continuous process of optimizing opportunities to maintain and improve physical and mental health, independence, and quality of life throughout the life course. I thought that was a really nice way to capture all the different aspects of it. I also think about it in terms of a lifetime of small actions we take to stay well, because aging really begins at birth. And I'll be saying that a few times, but we get older every day. And we want to be, all of us, I think, as independent as we possibly can. It means accepting aging as a natural process that, although I think our culture is not age friendly many times, there's a lot of ageism that goes around. Aging is a normal part of life, just as young adulthood and middle adulthood is. Aging is very normal. And trying to stay as healthy as we can be, despite whatever circumstance a person may experience. So I am kind of curious, and drop some ideas in the chat if you like. Why should we be talking about healthy aging for people with living with mental health conditions? And I'd love to hear from you. So take a moment, think, why should we be talking about healthy aging? I did mention earlier that there is some out there about this, but I feel like it's still a little bit, we're all on the new frontier. If we work with older people who are aging, we talk a lot about the health problems, and we talk a lot about the disparities in healthcare, and we talk a lot about recovery. I'm a psychiatric rehabilitation practitioner. I think about recovery and I think about goal setting, but why should we be talking about healthy aging? People learning how to support people, making sure that people don't feel as isolated as they could be, reducing stigma. Absolutely. Stigma in mental health and stigma about aging, because I think there can be that intersection between aging, mental health issues, and even people from marginalized backgrounds and populations who've been typically historically underrepresented in services. And when you've got sort of this collection of isms, sometimes people feel pretty poorly about getting older. And creating culture and system change to have better supports, absolutely. Plant that seed, oh yes, absolutely. And people think about a lot of different things. Ignorance is bliss about aging, but we should be talking about aging because there also can be things that we can do to make things better as we get older. So we all grow older, or many of us are growing older. And this is not a topic that's been brought up a lot. We know some things that Americans in general are getting older, right? So as of 2019, 16% of all Americans were 65 and older. And by 2030, it's estimated that 20%, 1 in 5 people in America, will be over 65. And when we think about people living with mental health conditions, there's not a lot of research. There's a lot of research that suggests that people are dying prematurely or living reduced lifespans for people living with mental health conditions. There's not a lot out there in terms of where they are in terms of the aging system or the mental health system. One report estimated that 40% of residents in supported housing are over 50. So that's sort of interesting. So we do know, as I said, that aging begins when we're born, but interestingly, healthy aging begins at birth as well, because those small steps that we take each day really can make a difference for our tomorrow, for our 10 years from now, for our 20 years from now, even for folks who may be taking medications, who may have experienced a lot in the public mental health system, experienced hospitalization or other kinds of trauma. There are things that people can do every day to stay well and healthy and to age even healthier. We do need to comment that people with mental health conditions are aging faster. Some of my colleagues and I did some research where we looked at functional ability, the physical abilities of folks, and we found that middle-aged, so 40 to 55-year-old folks who were receiving services in an outpatient mental health program, they performed strength and endurance and physical functioning at a level 20 to 30 years older. I'm going to say that again. 20 to 30 years older. So people who were 50 were performing physically at a rate of 70 to 80. So that's something that we as mental health providers need to know and we need to be aware of. That is not a hopeless message. It does mean that we need to encourage healthy aging and think about that. So we're going to be talking about that. And we should actually be talking about healthy aging for people in our mental health programs in their 40s probably, because there are a lot of changes that occur in 40s and in our 30s that could be staved off. And for people who may be taking multiple psychotropic medications that contribute to metabolic syndromes, that can lead to additional health conditions. All of those things can be addressed in small ways every day. So I think that the message shouldn't be hopeless, it should be hopeful. And we should be thinking about how we can do that. So why is healthy aging important? I think you all put some amazing things in the chat. Clearly you all know your stuff. I'm just sort of collecting some of the ideas out there from the research, but healthy aging is important because it's about living an enjoyable life with meaning and purpose and relationships, and adding value and contributing to communities, families, and society. So it isn't just that a person is feeling that they're taking and receiving services, but also that they are offering things, that that's part of our meaning and purpose. And all of us, as I mentioned, want to be as independent as possible. And that independence, as people age, I've worked in case management in outpatient services with older adults. And older adults really struggle with that as well, with or without a mental health condition. And I think it can be harder with a mental health condition. It just means that you may be adjusting to some of those changes of aging at an earlier age as well. Anything else that the reason that healthy aging is important? Isolation, and many people with mental health conditions are diagnosed with significant significant health conditions. Common physical health conditions include things like diabetes, arthritis, heart disease, COPD. So those are some common ones that we see. And we need to make sure that people do take care of their whole self as well. I think that we do need to encourage everyone to consider how they can move towards healthy aging, whatever age they are, and knowing that those small actions lead to big changes. As I mentioned, I do like the Pan American Health Organization framework. They were thinking about healthy aging and putting these ideas together, and they kind of had 4 buckets that I thought really fit with people living with mental health conditions as well, for everyone. And that is maintaining current level of health by doing the things that help us. Things like, brushing teeth or getting to the dentist, attending to cognitive health. Some people like to read or learn new things, or, I'm a Wordle addict. I'm sorry. I'm not always very good at it, but I do Wordle every day. And I know a lot of folks who do things like that to keep their cognitive health going. We also want to help people think about the quality of life that they have. What brings them joy, what helps brings meaning and purpose, and also taking some of the actions that are needed for healthy aging. So even, we should always be encouraging people to look for opportunities to grow, to improve physical, cognitive, and emotional well-being, whoever they are, wherever they are. I'll give you a small anecdote. At one point, I was doing some work at a state psychiatric hospital that focused on older adults, and we had developed a novel multidimensional wellness promotion intervention. And I was working with an occupational therapist, and we were running this group, and she said to the group, and it was like maybe 10 older adults, most in wheelchairs, who were in this inpatient setting. And they're like, so she asks the group, can old dogs learn new tricks? Everyone thought for a minute, and they were like, nope, old dogs cannot learn new tricks. And I was like, so these are, sort of the realistic attitudes and challenges that people may feel. They believe that they can't take any action, and therefore they sort of give up, and they say, you know what, I can't do anything. And I think that's where we have to kind of be the disruptors of that, or the encouragers of helping people move towards health and wellness, and taking small actions each day, and finding those resources and support that help the person where they're at make a difference in their lives to be as independent as possible. I do want to mention that healthy aging doesn't mean that you have to be in perfect health. Instead, it really just means that the person is invested in the actions that promote better health. And the United Nations has a slogan, which I think is great, and that is good health adds life to years. This idea of life, of a good life, despite your age, as you age, with whatever condition that a person may have. Um, so the first bucket really is maintaining health, encouraging movement and mobility. I've done research in physical activity promotion for people living with mental health conditions, and I have been just stunned by the simple changes that occur for people when we encourage movement. And when I say movement, it could be physical activity, it could be exercise, it could be dancing in your kitchen, it could be playing basketball, riding a bike, um, playing pickleball. Really, movement is critical for our cognitive health, for our brains, for thinking and processing information, for our emotional well-being, for staving off depression and anxiety, and also for our physical health, for our hearts, for our breathing and our lungs. So healthy aging is really about movement, and movement helps with functioning. Things like lifting groceries, walking upstairs, um, doing laundry. All of those things require a certain amount of physical strength that we lose as we all get older. And people living with mental health conditions may lose it a little bit earlier. So we need to be encouraging movement as much as possible. Also addressing and nourishing our emotional well-being and our physical well-being. So I like this term of nourishing because it's sort of like, how do we take care of ourselves? What does that mean for an individual as we age? Making sure that we have connections to people, that we get out of the house, that we talk to people when we're feeling sad. Also, making sure that we have access, and I know this is a big challenge for many of the folks in public mental health settings, getting nutritious foods. We have a lot, I live in New Jersey, there are a lot of food deserts in New Jersey where the main source of food, it may be fast food, or it may be like a 7-Eleven, or we have Wawa. It basically like a gas station that has a Quick Mart attached to it. So those are real challenges that we have to think about and find solutions, creative solutions to work around that. Also, rest and sleep is really vital to aging. It's also vital to our cognitive health and our functioning, and preventative health care, making sure that people get to the doctor and follow up with their care. Thank you. Someone popped in there, getting enough rest and also purposeful activity. Thank you. It can't just be, check off this random thing. If someone loves to play Monopoly, and that's something that really means something to them, you want to like help find the opportunities to play Monopoly or do whatever it is that is meaningful and important to the person as well. So that's a great point. Thank you so much. And showing people that we care, are invested in them. Thank you. That's really, really important as well. People need to feel cared about also. And that's quality of life, right? Is when we feel connected to people, and we offer things to other people, and we receive things, right? So healthy aging means that a person is finding some enjoyment in life and moments of happiness. And quality of life is those positive relationships that offer support and companionship. Also, finding meaning and purpose. I'm really interested in multidimensional wellness for people living with mental health conditions. And I worked with Dr. Peggy Swarbrick to create a new model of multidimensional wellness. And one area that we found, we did a systematic literature review, then we created our own framework. But one area that I think we don't do a good enough job in mental health is really thinking about a secular perspective of spiritual wellness, which is meaning and purpose. What's important to the person? How does that connect to something bigger than themselves? Are they a volunteer? Are they a parent? Are they a grandparent? Are they a great aunt? Are they a church member? Are they connected to something bigger than themselves, which can be very important for end of life kinds of discussions, as significant health concerns and death and grief comes along. It's very important that we kind of have that part of us that's healthy and well and quality of life. And also decision making, being able to make important decisions about housing, healthcare, and end of life preferences. We want to build the capacity for making decisions, teaching decision making skills if it's needed, using decision making tools or aids, things like shared decision making. Um, Definitely, people are putting in some great points in the chat. Opportunities to age in place, where they have established connections and support systems. That's a great point. And encouraging integration into the communities of their choice. Thank you. Yes, absolutely. Because people who are aging bring us wisdom. They give us perspective. It's a very important opportunity for people aging to offer their wisdom, but also to receive that sort of connection and meaning and purpose. Thank you all very much. Sharing life lessons, absolutely. You all are on, we're all on the same page. So it's pretty cool. We also want to think about improving physical and mental health or emotional health. And as I've been saying, everyone can take active steps towards health, but that really has to be sort of intentional. And it may be asking people to think about what healthy aging looks like for them, how they might move forward, what they might want in the future as they age. And that relies on daily choices of this, not that, or more of this and less of that, maybe. And there's, also needs to include talking about overcoming barriers. And I'm going to talk about WHOOP in a few minutes. I don't know if anyone has heard of that, but it's a way of thinking about making changes. And it's got some good research behind it that it is effective for people living with mental health conditions who want to exercise a little more, but it's got a lot of evidence in other places and spaces in terms of health promotion. And WHOOP stands for Wish, Outcome, Obstacle, and Plan. And I'm going to show you a little card um, uh, in a little bit. And that link for WHOOP, it's a whole, it's based on the research of Dr. Ottingen. I can't say her name. Ottingen, I think is the way you say her name, from Germany. And she's also, I think, at NYU. But there's, in the resources for the slide set, there is a link to that webpage. I encourage you to check it out. It's pretty cool stuff. But her main premise is that we have to help people think about the barriers they might experience and plan for those barriers to overcome them, which helps people get kind of unstuck. So kind of interesting work there. We also must consider age-friendly resources and supports that help older people meet their needs, learn, grow, and make decisions, be mobile as they can, build and maintain relationships, and contribute. We want to foster those abilities of a person. And even when people are living with mental health conditions, we have to sort of help people overcome what, my friend George Bryce calls stinking thinking, and I call, sometimes institutionalized thinking. So when people have been in the mental health system for decades, they may sort of start to, lose trust in their ability to make decisions and rely more on external folks for those decisions. That's not the case for everyone, but some people sort of get kind of trapped in that thinking. We have to sort of help them gently, push them a little bit so that they're thinking more for themselves and able to make important decisions and able to identify what kind of resources and supports would they want based on their communities of choice, in their spaces of choice, in their faith and their culture, and match that, and also with what their goals are, what they want for themselves. And I know that, for example, there's some innovative programs that are looking at getting people who are living with mental health condition out of nursing homes. So, in the past, one of my first jobs, and many of you may have worked in these kinds of jobs too, I worked in a nursing home as my very first job out of college. And in that nursing home, it was during a major wave of deinstitutionalization in Illinois, where I grew up. And at that time, a lot of folks who had been taken out of the state hospitals were transferred immediately from the hospitals to nursing homes. And I think that that may happen somewhat still as well. People may go directly from hospitals to nursing homes. And there are some programs out there that are now working to get people out of the nursing homes into more independent living settings, which takes, additional resources and supports. So we really want to match the resources and supports with people's preferences and thinking about also some of the physical environment in terms of support. Age-friendly communities is a big thing in aging services in the general sort of gerontology world, and that means having places that are welcoming and supportive, regardless of your age and mobility and things like that. And there's some really cool ideas that are posted in the Pan American Health Organization, and that link is in the resources. They've got a report that lists ideas all from North America and Middle America, Central America, and South America, ideas from all different cities about how they're creating positive aging spaces. And I welcome any thoughts. If any of you are doing that work, I'd love to hear some of that. Oh, the chat is rich with interesting stuff. I wish I could do like a word cloud with all this, but sharing lessons, absolutely Erickson's stage of integrity versus despair, helping people maintain that sense of purpose, and Independence Inc. Thank you. So I think that those are some of the folks who are doing some of that work to get folks out of nursing homes and into more independent living settings. And thank you so much. Someone's pointing out it's important that we don't lump all older people into one big group, but it's really different from each other. And we're going to be talking about that in a minute. And, the language from the literature is person-centered, but we always want to sort of really understand what that person needs because, someone who is 45 and living with a mental health condition may be working, have a family, own a house. They may be living in an apartment on their own. They may be, needing more supports as well. We don't know until we talk to the person about their needs, their preferences, and their strengths as well. I appreciate your point of that. Any examples that you'd like to drop in the chat of resources and supports for independence? And I was kind of thinking about, things like in New Jersey, we have a lot of older housing stock so when people are looking for housing and they're getting older, the resources and supports they may need for housing may be ramps if they need some kind of a mobility aid. It might be transportation if someone doesn't drive, so that they can get to the grocery store. Other kinds of resources and supports to stay independent may be like some of the traditional aging services like Meals on Wheels, where people deliver home delivered meals, where people receive meals at home may help people stay safe at home. Market services that deliver to seniors. Thank you. Actually, I used some of those when I had COVID. I ordered my groceries online. I was like, why am I not doing this? Local community centers to teach people to learn how to play games and learn new hobbies. Senior centers are really quite cool. And your areas, I mean, they're different. We're all very different regionally, but the ones near me, they teach computer classes and dances, and they have movie night. And I mean, really kind of an amazing array of resources available at the senior centers. Also, low income housing. Thank you so much. It's, we call them, sort of, uh, all I can think is the apartments for older adults that offer a lot of different services, and some of them offer services like housekeeping and meals, and those are targeted to general population and anyone with any kind of disability, and those may be resources for people to live more independently with a bit of support. Lifelong learning classes. Oh, wonderful. Yeah, that's a great resource. And I think is that called Evergreen? I know, anyway, so there are a lot of classes and opportunities for people to learn, and that is so cool. Oh, very cool. So someone is giving an example of a program, a senior companion program that match more active seniors with less active seniors. Oh, that's very cool. Well, thank you for sharing that. So these are some great ideas for programs and services. So um, I am going to ask you if you have any thoughts about the actions that you've seen older adults take or you have taken to age well. I've seen people, I take morning walks. I try to take walks a couple times a day. I feel like I'm investing in my aging process and my health. Um, Also tracking water or crossword puzzles or taking computer classes. Oh, I also see some other cool thoughts in here. Someone's mentioning sex life. Absolutely. So I mentioned this in a multidimensional wellness group that we put together. I was part of a team that worked on at this psychiatric hospital. They looked at sexuality as a dimension of wellness, and it was very interesting. They talked about it both from an intimacy perspective, but also as an identity, which I think is a whole nother realm that we haven't even scratched on the surface of. But I'm really glad that you brought that out because there's very little discussion about that, and yet there in certain senior communities there are rises in STDs and sexually transmitted infections because people are not talking about good, healthy sex practices and changes in our bodies as we get older. Also, changes in bodies who, for folks who are taking multiple psychiatric medications, which impact sexuality and physical health in so many ways. Um, and people are suggesting intergenerational opportunities. iPods and music is so powerful. Diet and exercise and bike riding, absolutely important things. And getting adjusted to technology. There's actually some great research out there that folks are doing to, of what resources older people and people with mental health conditions who are aging need to access technology, which I think is really, really cool. And local senior games, weightlifting and yoga, silver sneakers. Oh, that's great. That's a great program for exercise. People have gone back to college to finish their degree. Woo! Um, and people have some fears, and people using other medications like psilocybin. I don't know if anyone here has heard of death doulas. A friend of mine who's a peer in New York City and has introduced me to this idea of death doulas who help people through the aging process, sorry, through the dying process. And that's a really, really interesting area of work, and I think an area that might be helpful for our the folks that we support as well. People volunteer, um, elder law, Center for Disability, legal support. Thank you. That's really important as well. Is as we get older, as people that we serve are getting older, they may have more and more legal issues. Whether they're unfortunately victims of abuse, but they may also be, facing evictions, or there may be other kinds of legal issues that come up, like non-payment or other kinds of things. Senior Planet is a great resource online. Thank you for that. Um, and someone is interested in being a death and dying doula. Well, very cool. You all are doing some very cool things. Thank you for sharing them. So, some ideas. You all clearly know your stuff. I'm going to introduce some other ideas. Maybe it's already things you're thinking about. Maybe you'll be taking some new ideas away from all of this, I hope. Or maybe we're just continuing the conversation. So, there are things that we can do at a systems level, right? And I think that one of the most important things that we can do is to change how we feel, think, and act about age and aging. Healthy aging can only take place when we think about aging as a positive thing. And sometimes that has to come from within ourselves. I was doing some work developing some curriculum about older adults for peer supporters, and one of the members of the team kept making, and she was an older adult, kept making deprecating remarks. Well, it's because I'm an old lady. It's old and I said, I'm really uncomfortable with the way you talk about yourself as old, and that kind of energy actually can contribute to ageism, whether that's internally, like when you start to believe yourself that you can't make changes because you're an older adult. That's dangerous. And when we have those attitudes internally, we may accidentally kind of have that spill out over on the people that we support. So that's why I really encourage you to do some work for yourself and ask yourself about these ageist questions. Like, am I ageist? And there's a great bloggist. Her name is Applewhite. I can't think of her first name at the moment, and she has a blog called Yo, Is This Ageist? And it's really creative. It's really fun. I use it in one of my classes that I teach, to really question, is this an ageist attitude? Is this an ageist practice or policy? So we really should be focusing on ourselves, but also helping others think about their capabilities and how we can do things as we get older. So that's important. And then there are some programs we can use. There are also some one-to-one strategies that can be helpful when we support aging. And then, so a really good discussion about death and dying. I appreciate that. Thank you, Ashton Applewhite. Annalise, you are the best. Thank you. I think on my feet pretty well, but I could not think of her first name. Ashton Applewhite has a book, and she's awesome, and she has a website, and her blog, Yo, Is This Ageist? Is really, it's fun, but it's also really good learning and thought provoking. So I encourage you to check it out. And the the golden bachelor and bachelorette. Interesting, right? That we're going in that way. So I encourage us all to take on ageism in our spaces as best we can. Fight those stereotypes, prejudice, and discrimination that we focus on, that are the limits that we put on ourselves or others because of age, because that really gets in the way of relationships, how or when people might access services. If you're sort of reluctant, I got my AARP card and I was like, yeah, thank you, no, because I think they send them really prematurely. Anyway, but that's a funny example. But you can think about when and where are people getting the services? If it's an aging provider, are they willing to talk to an aging provider if someone's 45 and they need a service that's offered by an aging program? Also, developing age positive spaces, talking to older people with mental health conditions, like what would that look like? What is an environment that would look comfortable? And I mean, we could think very concretely, like, if someone uses a walker, they need a wider doorway. Or, I remember, running facilitating groups in very small rooms, and if someone's a wheelchair user and the doorway is small, it's really awkward you need those physical spaces, but also those places that are welcoming to all ages. There's an interesting organization that I've visited once, in New York City, that they had a sort of a outpatient program for older adults living with mental health conditions, and they sort of said, people really selected different music. They didn't feel comfortable being mixed with people who were in their 20s and 30s. They felt like they were sort of on a had different idea of what felt comfortable, what they wanted to do, and they didn't really want to be mixed in with the younger population. And some people really love that energy and some people don't, which goes back to the idea that all older people, if you meet an older person living with a mental health condition, you meet one older person living with a mental health condition. So we need to be really aware that everyone is really different and try to get people comfortable in those spaces and places that we create. Elizabeth, somebody mentioned that Isabel Allende has a TED Talk on this topic. Oh, that's very cool. All right. So also, some of the best practice interventions, combining services that address physical, emotional, cognitive, and developmental well-being, really important. There are some examples for people living with mental health conditions you may be familiar with. One program is Helping Older People Experience Success. Dr. Bartels put that together about talking to a doctor for older adults. Also, the Integrated Illness Management and Recovery Program that developed by Dr. Muser and Dr. Bartels to help people address their health and emotional recovery and integrated programs of physical and emotional health services. So some places use co-located services, some places use integrated, where there's like a team, you know, a geriatric clinic. For a while, I was doing some work in Pittsburgh, and they have the great Benedum Geriatric Center where everything was really integrated with a team of folks. That's one of the best practices. Use of multidimensional wellness assessments. I've done a lot of work in this. I'm really think that this is the way we should be talking to everyone, because we get a view of the whole person and recognition that each person is unique and all of these different pieces are connected. And you know, one area that you know we really felt like was so important is thinking about developmental wellness. Like, where are you at as being a middle-aged or older adult? Like, what does that mean for you, and how do you sort of integrate all those pieces of yourself? Promoting physical functioning. We talked about that earlier. Walking, steps, getting off the floor, putting away groceries. All of those are really, really important for living independently and for feeling good about yourself. And those obviously can be adapted for wherever a person is at physically. And physical therapists and exercise physiologists are amazing folks who can help really adapt and help people move towards a different type of physical well-being. And encouraging social relationships. There's such a wave of social isolation. I think the Surgeon General just put out that epidemic of loneliness for all Americans. And I think it's particularly true for people living with mental health conditions and receiving services. And we know social isolation worsens health outcomes, quality of life, and emotional well-being. So anything we can do to really connect people to other people is really important. There's an interesting program that has a lot of evidence behind it called CBSS, CBSST, Cognitive Behavioral Social Skills Training. And that really came out of some work out of the VA that combined CBT and social skills training. And that really connects all that. And I do want to do a huge shout out to peer supports. You know, I did some work with the Academy of Peer Supports, and I put that link in the resources. And they have a new certificate, a 5-course certificate for peer supporters to work with older adults. And that is so cool and so important. And I think peers are so vital in every realm, but particularly as we get older, seeing, you know, examples of other folks who are doing well and getting supports and sharing wisdom and co-creating and co-learning is healthy. It helps us grow. It helps us move forward. Are there examples of multi-dimensional wellness assessments you could use with clients? I would definitely refer you to SAMHSA. It has some great work that they have put out in terms of wellness. Also, if you Google Dr. Peggy Swarbrick, she's got some great assessments at the Rutgers Graduate School of Applied and Professional Psychology, GSAPP. She's got a lot of resources, and so there are some assessments that she has been involved in and supported with Dr. Cook at the University of Illinois at Chicago. They're doing some work as well. So I would check out those in terms of wellness assessments. Pet cafe for connection, please. Can we have that? Oh, we have a peer specialist here. That's great. So if you look on the resources, you'll get a copy of the slide set. You can click on that link. For people who live in New York, you get a certificate. If you don't live in New York, you don't get a certificate, but you can sign up for the certificate in older adult services for free, and you get a lot of knowledge and a lot of resources. Some individual practitioner strategies. We talked about person-centered practices. Healthy aging is really defined by each person. You know, it's what I think is different from what you might think. We're all very different, and the people that we support may have very different ideas of what that looks like. So we have to sort of know the person's preferences, their needs, their strengths, and supporting them to live the life that they want and to continue to be as integrated in the community as possible. And of course, I'm in psych rehab, we really partner and collaborate with people, and we want to make sure that the older adult, the person who is aging, is really invested in the process, and sort of we are having that dialogue with them. In aging, I worked in the community, and we always had to balance safety and independence. And that's a hard balance, letting people live a life they want while being safe when we have that role. If we're in that role of being responsible in some way, that's really, really hard. It's a hard discussion. It's hard balance, but it's really kind of important that we promote the rights and advocate for the people that we serve and support so that they have as much influence over their decisions in their life as they can, because that's it's their life basically. We want to focus on strengths, build on the strengths, identify them, and remind people of their strengths. I mean, some people kind of forget who they are when they've been in mental health services for a long time. Sometimes that whole identity gets sort of left behind. We did a health promotion intervention in the community, and there was a woman, and we were talking a lot about exercise and supported exercise, helping people move more. And I had some PT students who were helping me, and they were, there was one woman who, she was experiencing some symptoms on and off, and she was pretty overweight and out of shape. And they were sort of like, okay, well, so blah blah, so Mary, have you ever had a time in your life where you did exercise? And she said, oh yeah, I was a track star in high school. And there, we all went, what? So we don't know what people's strengths are until we really dig and we listen and we talk. She didn't want to be a track star now. Running was not something that she really wanted, but she was interested in how she could move safely and do things at this point in her life and change. And also maintaining that positive aging perspective. Like, it's really a challenge, but we want to recognize that growth and recovery and quality of life, it takes place at all ages. We want to maintain that hope that change is possible for everybody, and maintain a perspective that people learn and grow throughout their lives. So this anti-ageist perspective can really offer hope to the person, and kind of energy, maybe some motivation to help them move forward. And I see some more notes in the chat here. Lots of peer supports. I'm awesome. It's so excited to see. Yay, we have peer supporters. You guys are awesome. Um, Having trouble with my mouse. So some just kind of final suggestions would be, talk about healthy aging. Ask people, what does it mean for you? What does this idea of healthy aging mean for you? How do you see aging? What do you want for your life in 10 years, 20 years? Do you know people who are aging in a healthy way? Also, I always find it's so important to understand what a person's interests and preferences and choices are about their aging, thinking about their values, like what's really something important to them. If someone were to ask me what's really important to me now and as I age, I'm going to have to say my cats. I really want to have a place where I am got my cats. They're part of my life, and that's part of my healthy aging will be pets. So knowing what's really important to the person is, and you want to lift that up and value it and help them sort of maintain that. Also acknowledging a person's expertise. It could be really a challenge, but it's important that we acknowledge their life experience, that they bring to us their life story. And in a way that informs where that story is going as they age. It just, and I'm going to say this, I think I said this earlier, but I'm going to say this again because it's important for us to hear it, and I think it's important for us to share with the people that we support that healthy aging doesn't mean that we're in perfect health. It doesn't mean that we don't have a bad knee or that we use a cane or whatever, but it really means that a person is invested in actions that promote better health as they age. So I think that that's really important, and to try to create a plan or intentions or actions. And I know a lot of you are working in ways where you are probably helping people set goals, and you have, certain paperwork that you have to document, but what does the person really want? So, any suggestions that you have that I may have missed about healthy aging, and what is a critical component of that in our interactions with others? All right, well, we'll move forward. A note on empowerment. Empowerment is so critical in ways to help people move forward. So I think that one of the most important things and powerful things we can do is listen. Listen to what other people are saying. Listen to our consumers, our clients, our coworkers, our peers, to understand where they're coming from, to help them make informed decisions about resources and care and any supports they may need. Supporting that voice and choice so that their ideas and thoughts and perceptions are out there so that people understand them and are working towards that to support that if that's needed. Um, someone, thank you, put in the chat, it would be helpful to share positive messages, images in the media to highlight and encourage healthy and positive aging. Absolutely. And call out the stuff that's negative, right? So if we see that in our workspaces, in, when we're supporting people, people, may kind of be down on themselves for their age and be like, hey, it's kind of a miracle to get to be an older person as well. And also, we want to be able to explore the strengths, abilities, oops, I just jumped ahead here, and needs of the person, exploring their values, using peer support to combat ageism and ableism, right? When there's discrimination based on ability to walk or do steps or seek employment, volunteer opportunities in communities. Encouraging self-advocacy, encouraging people to speak up for themselves when they're not being heard, to make sure that their views are being respected. And this can be all kinds of services. And I've talked to housing providers and they've shared stories with me about people living in supported housing who, faced cancer or some very significant disease process. And the person didn't really feel comfortable talking about it, didn't want to make any decision, and ultimately made the decision not to receive treatment. And that's hard to be able to really respect someone's perspectives, give them the information, make sure that people understand, but really respect whatever the person decides, and offering peer support, as I mentioned. And getting those legal support. Someone mentioned that earlier, but it might be entitlement eligibility, or age discrimination in housing, employment, or communities, getting reasonable accommodations. Also, we have to think about, power of attorney, living will, inheritance. Those kinds of issues may come up more as people get older. Some folks are posting some resources for recovery support training specialist certification in Connecticut, some action items. Okay, but that's something else. So I want to leave you with the idea of WHOOP. I don't know if anyone has studied WHOOP, but again, this is from Whoop My Life. You say the wish of healthy aging, of whatever the person is interested in, the outcome, maybe that I can live as independently as possible, or that I can, make it more concrete. The outcome being that I can walk to my mailbox and back. The obstacle is, sometimes my hips bothering me, and the plan, to sort of overcome any obstacles. If I have hip pain, then I will use an ice pack and try again in a few hours. So I like WHOOP. It's an interesting idea. So the summary for today really is: healthy aging means maintaining current health, focusing on quality of life, taking actions to improve our health, and identifying any resources and supports that we might need, and using those resources and supports. And we can support healthy aging using system approaches, best practice interventions, and collaborative relationships. So I welcome any questions at this time. I've got some references for you, and I promised resources. So there's some resources there that I encourage you to check out. We've done some work in the past at the NEC MHTTC. We've put those on a web page. Kati, I'm going to turn it over to you.
Thank you. Thank you, Dr. Zechner, for that wonderful presentation. And we have so much shared feedback in the chat. And wow, this is so informative, especially for the topics, like I mentioned before, your feedback is very important to us. And as a SAMHSA funded program, we are required to conduct an evaluation of all of our training events. Now, based on the feedback we received in the chat, I am sure you found this webinar to be very useful in your work. And therefore, if you could please take a moment and share your feedback by hovering over the QR code, and I will also share a direct link in the chat if that's easier for you. I will also email this link to everyone who attended today, so that way, if you cannot complete it now, you have a moment to complete it before the end of this week. Again, here in this in the chat, I do see some questions. How do we access the PowerPoint? That's a great question. So the PowerPoint and the recording will be posted on our website, and I will send the link to the direct link to download on our website within a week. So just want to let you know, as well as certificates within a week as well. So next slide, please. As mentioned before, Dr. Zechner also has a wonderful podcast, Flourishing at Work, a healthy plan for professionals. You can find our podcast channel on Spotify, Apple Music, and Podbean. Next slide, please. And if you missed any of our previous webinars, you can access our wonderful resource library. And that's where you'll find printed products, resources, as well as recorded webinars. We also have Healthy Knowledge Self-Paced course modules so that you can do your learning at your own time and pace. And it's also self-directed. So just wanted to also mention that resource we have. Next slide. And again, as just previously mentioned, what certificate of completion will be emailed to you within 7 days. And lastly, please follow us on social media just so that you are able to keep the rest of all of our training opportunities, whether it's products that we're launching, videos that we're launching, webinars that we're launching, or if you would like to listen to our new podcast episode. And you can follow us at Northeastern Caribbean MHTTC on Facebook, Twitter, and LinkedIn. Again, I want to thank everyone for joining us today. We hope that you found this webinar very informative and useful in your work. We also want to acknowledge that it is the holiday season. So we also just want to wish everyone happy holidays if you observe. And thank you, Dr. Zechner, if you have any comments you'd like to share.
Thank you, everyone. I'm so grateful for all of the sharing. I've learned so much, and I wish everyone a happy holiday and pass on the word about healthy aging. We can all age well and age healthier. So thank you so much for coming today.
Thank you so much, everyone. Have a good day.